Migraines are very painful and very real. If you're fortunate enough not to have experienced a migraine headache, consider yourself lucky. The unfortunate reality is that migraine headaches are very common. In fact, we can safely say that over 1 billion, that's with a B, not an M, 1 billion migraines occur worldwide each year. My name is Dr. Brent Thierry, and I'm a chiropractor in Maple Grove, Minnesota. If this is your first time watching one of our videos, I strongly recommend you check out our channel, specifically the video on 3 things that separate a good chiropractor from a lousy one. Now, take my word for it, you don't want to find out the hard way what a bad chiropractor is. Now, before we jump into this video, it's important for you to understand that this video is for general information purposes only, and it should not be taken as specific medical advice. You absolutely must consult your doctor, your chiropractor for any medical, headache, migraine related conditions. Okay, so let's take a quick look at migraines. So here are some facts about migraines taken from the Migraine Research Foundation. Around 12% of the population, including children, suffer from migraines. Migraines are most common between the ages of 14 and 44, and migraines tend to run in families, with around 90% of sufferers having some form of history of the illness in the family. And migraines, they're serious. They are the 6th most disabling illness globally. It's estimated that every 10 seconds, so every 10 seconds, someone in the U.S. goes to the ER for migraine treatment, with around 1.2 million visits annually for acute migraine attacks. And once a migraine kicks in, over 90% of sufferers are unable to continue to function normally in their daily routine. Now, before we dive more deeply into migraine headaches and how chiropractic treatment might help, let's just take a step back here, and we're going to look at headaches themselves initially. So headaches in one form or another are very common. They affect actually about half of the population, and they come in various shapes and sizes, and these include tension headaches, sinus headaches, and migraine headaches, and that's just to name a few. Now, one of the most common headache types is called a cervicogenic headache, which means that it originates in your neck or the cervical spine. Now, how does the neck play a role? Well, if we look into the normal function of the body, the neck should have a free and independent range of movement. However, muscle tightness, joint restrictions, these can occur in the upper regions of the cervical spine, and these abnormalities can trigger really a number of different symptoms. Cycles of muscle stiffness, tightness in the neck, inflammation in the surrounding areas, nerve irritation, shooting pains. Now, people experiencing cervicogenic symptoms, they usually complain of the pain really starting around the base of the skull and then having a pain travel into the skull, the eyes, and then really into one or both sides of the head. Now, the migraine headaches, they tend to be more neurological in nature. They may also have a cervicogenic component as well. So the question is, what can we do about them? Well, typically the first solution many of us run to is medication. Now, some migraine medications may be effective at prevention, where others are designed to be taken more for symptomatic relief once a migraine headache starts. There's dietary modifications, including reducing caffeine, sugar, alcohol, gluten. Those have all shown strong signals in individuals in reducing or eliminating migraine symptoms. And then we also have chiropractic treatment. Can chiropractic help reduce the frequency and the severity of migraine headaches? This question becomes even more important when medication and those lifestyle modifications really fail to reduce migraine symptoms. Now, fortunately, chiropractic treatment is often very effective in addressing the underlying mechanical problems that may be contributing to migraine headaches and other associated symptoms. Now, chiropractic treatment, it's going to typically include joint manipulation, that's the adjustment, and that restores movement in the upper cervical segments, and various other therapies and modalities to help reduce pain and inflammation. There's also therapeutic massage and myofascial release techniques that can help break down some of those trigger points and eliminate some of the adhesions in the muscles of the neck, the upper back, the shoulders that may be contributing to headache symptoms. And also proper education and training and the use of rehabilitative exercise, that can also help minimize recurring migraine headaches and help strengthen the surrounding tissues. There's also some cool research coming out on the effectiveness of chiropractic care in migraine treatment and prevention. So actually a study published in 2017, and it was in the European Journal of Neurology. It looked at a randomized set of 104 patients who were known to be suffering from at least one migraine per month. The active study period lasted for about 3 months, and then they did checkups and follow-ups at 3 months, 6 months, and 12 months after the study. Now, the people in the test group were comprised of the following: those who received chiropractic spinal manipulations or treatment, those who received the standard pharmaceutical treatment for migraines, and those that received standard placebo manipulations. Now, here's the cool part, the most exciting part. The group of people who had actual chiropractic adjustments, actual chiropractic treatment, they saw their symptoms significantly reduced. And it wasn't just immediate, it was through all of the follow-up checkpoints, 3 months, 6 months, and 12 months out. And that same group of people experienced a reduced duration of the migraine when compared to those other groups. That's pretty cool, considering that many individuals may not get relief from the medications currently available, and it's an effective treatment method that can address the underlying cause of our symptoms without the use of some of those more invasive interventions. Now, whether you're experiencing migraine headaches or really any type of headache, it's important to realize that it's not normal. So headaches are common, but they're not normal, and these symptoms should be addressed. So if you or someone you know is suffering from headaches and you're unable to find relief, consider giving chiropractic treatment a try. It just might be the key to headaches or even migraine relief in your life.